Welcome to this special program on Women's Day, and of course a happy Women's Day to all of you out there, not just our women viewers but everyone at large. Now every year Women's Day gives us an opportunity to focus on issues which concern women. We talk about equality, we talk about equality at the workplace, breaking the glass ceiling, balancing work and home, labor force participation and many other aspects. And I've been doing this over the years, but this year I thought was a good opportunity, when we've all been dealing with the brunt of COVID-19, to feature, celebrate and focus on the role of women in battling COVID-19. Yes, we've been talking about COVID-19 warriors, COVID-19 heroes, but there are also so many women at the forefront of the COVID-19 war. Now, in different aspects of it, whether it is scientists who are in the, at the head of breakthroughs of medical interventions, in vaccinations, whether it is nurses who are there to administer care and help, or whether it is business women who are making sure that services reach those who need it. So today I want to welcome a very special panel of women speaking with us. I have with me Dr. Gagandeep Kang, professor at Christian Medical College, Vellore, and one of the foremost virologists in this country. Ameera Shah, MD of Metropolis Healthcare Ltd, is joining us on the show today. And I'm also with Dr. Suneela Garg, Director Professor and Head Department of Community Medicine. She's also part of the India COVID Task Force for Lancet. So welcome to all of you. Thank you so much for speaking with us today. And even as I speak to these three amazing women today, I also want to point out the contribution of all of our nurses, of all of our ASHA healthcare workers, all of those who have made sure that even though they have been working through the pandemic, they're still there to take care of our needs. So with that, let me begin. Ameera, let me come to you first. And I want to come to you simply by asking about your experience through this last year of COVID-19. Now, your company and many others have played a vital role in first getting COVID-19 tests out to people. There was suddenly a huge need to test and test more, and very little experience on how to do that. Tell us how you managed that.
Obviously the COVID crisis has been a huge challenge for the whole healthcare industry. Pretty much overnight, we were sort of told in private sector to engage with the government and start providing these services, especially for testing and hospitalization. And there was really no certainty. We didn't know where equipments were going to come from, where reagents were going to come from. Things were in lockdown. Employees couldn't get to work. It was mayhem. I remember, our people used to be on the streets trying to go into home services, and they were beaten up by policemen, because you were not allowed to be walking on the street. So things were very difficult. And I think what added the most complexity to everything were the rules in India are different, not state by state, but municipal corporation by municipal corporation, which means in a city like Bombay, where you may have 7 to 8 municipal corporations in Greater Bombay, the rules were different in every one of them. And I think this added a very different layer of complexity when we are operating in 200-300 cities and towns across the country. So it was very challenging. And I think women have really borne the biggest brunt as part of the COVID crisis. Not only became difficult for them where their families told them not to leave the house or come to work, but they had huge amounts of pressure, even though they felt the purpose and the passion of wanting to come and really take care of patients, because that's one of the reasons why they're in healthcare. And at the same time, they were expected to do their homework and take care of children and homeschooling. I think it's been incredibly difficult here, but I think like everything else in life, women have realized how they are really able to do it all and are really able to balance multiple facets of their life. Unfortunately, many of them have had to quit their jobs. Many of them have had to let go of their livelihood, their self-respect or financial independence. And I really hope that as we see this crisis coming to an end, not only the government, but private industry does more and more to recruit women back into the workforce.
That's very truly said. This whole work from home, in the beginning, there were a lot of memes and there was a lot of talk about how men were now doing housework, but it was a double whammy for women who had to continue working from home and go through their roles and responsibility as caretakers for their children, for the family, etc. Let me come to women in medicine specifically. And Dr. Suneela Garg, I want to come to you because at the forefront, doctors, nurses have been women, and it's very important to highlight the role of women as COVID-19 warriors as well.
Yeah, definitely. It's a very, very important question you have put in, whether they are doctors, whether they are healthcare workers or frontline workers at each level. They had to do a lot of, job, whether, you talk of the healthcare settings, wearing of PPEs, and then for long hours, which was, even compromising with their menstrual hygiene management and all that. It has been a very, very stressful kind of a situation for them. The second thing was also the frontline workers, apart from doing their job, that means, they were distributing supplementary nutrition, like I would take example of ashas, anganwadi workers and all that. But apart from that, they were visiting from house to house, and they were not able to visit their own families for quite some time. So that is another important thing. The third point is that the home responsibilities never got compromised, because, they were healthcare workers themselves, frontline workers themselves, and then, they had to take care of the people at home themselves also. Another thing which was already been pointed out by Ameera, that women, in Indian settings are not that tech savvy, so, they couldn't work more from home, and they lost their jobs as well. So that is where I see that, because if they were frontline workers or healthcare workers, they had to come and work themselves. But for the other segment of women, it became very difficult during the COVID pandemic. But nonetheless, they have stood up and coped with the whole situation. And we feel that, this year is going to be a much better year. But women, I think from the beginning, they are better social survivors, and they can survive to any situation. And I remember, you see, when they used to come back home, different resident welfare associations were also hesitant to admit them and all. And that was kind of a situation where we used to feel that there is a need for sensitization of, these associations. And we took up this issue with the government, and, lot of, sensitization was done on that part also. So I feel that women have been at forefront of this pandemic, in different capacities, whether they are, the policy makers, program managers, or, they are technocrats, like my colleague Dr. Gagandeep is there, or they are public health experts who are sitting day and night in the, different settings and guiding the whole program primarily. And every day the strategy would change, because we are dealing with new normal. So that is where the whole thing for women, and I will say that women have been able to stand up to the situation, and have been able to monitor. All my colleagues share the same thing with me and echo my sentiment.
No, absolutely. So it's been tough for everyone. And all of our COVID heroes, our COVID warriors, those from the medical fraternity, have been showered with the admiration and praise of everyone. But I think it's important also, and Dr. Gagandeep Kang, let me come to you here, to highlight the role of women in STEM. To highlight the role of women in science, in the medical fraternity, at the forefront of medical expertise, which came to the fore and was much required at this point. How tough is it? Because the very traditional thought is that this is a field for men. There is a lot of gender bias which seeps in, isn't it?
Gender bias in all aspects of science and employment. But I think in SARS-CoV-2, what we've seen is a lot of leadership from women, despite all of the problems that my colleagues have highlighted. If you take a look at the Pfizer vaccine, for example, it was Catherine Jensen that ran that program. If you look at the development of the vaccine from BioNTech, it was a couple where, the strongest medical science really came from Muslim. If you take a look at in India, the inactivated vaccine Covaxin, Sumati is the leader of the R&D program at Bharat Biotech. Mahima Datla's company is going to be making its own vaccine, as well as making the vaccines for Janssen. So I think if we take, Oxford, of course, we all know Sarah Gilbert. She was the first one to actually get a timeline right. for how long it would take to get a vaccine. When she came out and said we'll have a vaccine by the end of the year, a lot of us who are engaged in vaccinology thought that was very ambitious and a timeline that we would have a hard time meeting. But she was right, we did it. And we did it together. Not just women, but certainly women leading in many endeavors to get vaccines to people. So, absolutely, women can lead, women can handle a lot of things. But I think one of the things that we really need to focus on for the future is how much this stretches women and what we need to change so that we never have to ask this much of women again.
I think that's a very important question, Dr. Kang. Let me come to you for a follow-up. And if you can add what your experience has been. Do women in medical fields have to also work twice as hard to prove themselves in the same way? Do you find yourself sometimes held to higher standards than everybody else? I mean, that's the experience we see for women in many other fields. But how is it in your field, and how was that experience through COVID-19?
I think for women in all fields,
Yes.
women have to do way better than men do to achieve the same levels of recognition. It's not, medicine being different from engineering, being different from the arts in any space. I think you do have to work harder, and it's unfair to women because not only do you have to work that much harder to do well at work, you also have a society where you continue have to shoulder burdens that are very, very culturally assigned to women across the board, family responsibilities that go beyond your nuclear family. So I think if we need to think about changing things, I don't think we should go profession by profession. I think we need to think about how society needs to make it easier for women to stay in work when they want to and to come back to work should they want to take a break that is necessary for them to raise their children. We don't have any of that at the moment in medicine or in anything else. In medicine, in fact, I think it's a little bit easier than in many other fields because there are so many women in medicine. We may not see them all rising to positions of leadership, but whether it is doctors or nurses or anybody else, we have a lot of women who are uh, in medicine providing the same level of professional care in multiple fields. Even there's a divide. There are fewer surgeons than obstetricians. The paramedical sciences have more women because that fits in better with their lifestyles. But how do we change that? In medicine, it's probably easier than other fields, but everywhere the change needs to happen.
Yeah. Ameera, in your experience in business, in the corporate world, where do you think women need that push forward? Where do they still face those biases? And what would be your message for other women aspiring to achieve what you have?
So actually, I grew up in a family of doctors. My mother and father are both doctors and professionals practicing. And what Dr. Gagandeep Kang said is absolutely right. You see a lot more women in the medical field than you probably do in business. And often, I think what your ecosystem is made of is actually what influences how the women in that ecosystem get treated. So even in the business world, for example, even you're engaging with top CEOs, top chairmen across the world, there tends to be, a certain hesitation about how they would interact with other women who are at their same equal level, because they are just not used to it. And they've always seen, the women in their lives as their young daughters or as their wives or their mothers. And therefore, they're not always able to imagine the situation of sitting across a table with another woman and even having something like a negotiation, right? It's something that is very difficult and awkward for them. I've been in many situations where the men can't look me in the eye when they're actually discussing something for me, because they just feel really uncomfortable by it. And I think and this is just something, you've come to sort of see that this is not anybody's fault. It's not a blame game. The men are conditioned the way they are in our country. The women are conditioned differently. And all we can all try to hope is that as generation by generation, we keep creating new role models, that the mindset changes without blame. And hopefully we can all move together as a society forward. But I think in corporate India, like with women in general, you'll see that to get to that leadership level is very, very tough, because everything in your life comes at the same time, right? You're trying to build your career, you're trying to manage your children, you've got your family, you've got your personal hobbies, and how do you keep it all together? Because the expectations are different from women. But the ones who actually manage to come to the top, I have to say, on the flip side, while it's a very unfair journey, those of us who have managed to reach somewhere land up actually getting a disproportionate amount of visibility, right? Because there are such few women who've actually managed to reach leadership levels that you actually really stand out in the crowd. So very often I walk into a conference room, I'm the only woman amongst 50 men. These things just, it's somewhere, people notice you differently because you're the only woman there. So, everything comes with its good and bad. And we just have to learn to take it as, with a pinch of salt and move forward.
The thing is that even today in 2021, we're talking about a situation where the ratio of men to women in positions of power is so skewed. And this conversation has been going on for decades. Dr. Suneela Garg, what is your advice to women aspiring in the fields of medicine, in the fields of scientific discovery, on how they can stick to their dreams and get ahead, and how things can be made fairer, honestly?
I feel that basically awareness creation amongst, like if one has reached a, domain like Ameera was just mentioning, or Dr. Gagandeep mentioned, or, I myself with 4 decades of experience in public health, I feel that quite a number of times we have to think of, that what is our second level or what is our younger level, how they're going to aspire to these positions and how we make comfortable for them. It is, the decision making, empowerment and knowledge creation is very, very important part of that. So that's where we have to keep pushing them, because in several, and I have been the first president-elect for my National Association for Preventive and Social Medicine, and also for Organized Medicine Academic Guild, which is a combination of 15 associations. And remember, it is not a kind of a task which comes to you automatically, because, every time you have to see that, okay, for so many years, there have been only men who are leading there. So you have to raise your voice, you have to, but then at the same time, you do not compromise with the quality of work. And definitely, as has been pointed out by my colleagues, that you have to, in order to prove yourself, you have to do double the amount of work. There has got to be patience as well. And but I will say to all my fellow colleagues that, aspiration is one thing, empowerment is another thing, awareness creation to reach to a goal is another thing. But most important part is that do not compromise between your families and between your work. There has to be a balancing between the two of them, because we are also made like that. Primarily, quite a number of times when women are offered, administrative positions, they will, refuse that, because that may, want them to stay for much longer hours, like 7 o'clock, 8 o'clock, 9 o'clock. And because the position demands like that, but we are also conditioned like that. And I feel that if one does their work properly within the given framework of time, one can accomplish their task. But vision and mission is something which we ourselves in our different positions have to, provide to our younger, fellow colleagues, so that they can, rise to the position, but they can rise comfortably, because many of them are in the mid careers and all that. They have families to take care. So I feel that is one of the most important things. And let us not hesitate. Let us give them opportunities. That's how they will rise to this situation. We give them more exposure to whether it is our medical career, whether it is our research, whether it is, representing on different forums and all that. So, or the decision making. And that's always, I have felt that this is very, very essential, and they must be given the opportunity. They must be given, empowerment to have a dialogue.
Absolutely. For women who are watching, all of you are an inspiration and a reminder that women can and have achieved so much and have been at the forefront of this fight against COVID-19. They may not always get all the glory, but they're definitely the backbone from top to bottom. Like I mentioned, from your health workers who go into rural areas to make sure that vaccinations will be done in time, to testing, to the women in home who have been managing the work from home scenario through the pandemic. Kudos to all of you. Thank you so much to all of you for joining us on this special occasion today, and a happy Women's Day to everyone watching.
Thank you.
Thank you so much. Thank you.